Hello and welcome to 2024 Promoting Interoperability and Improvement Activities. Here at the Kentucky Regional Extension Center, we offer services for both your outpatient and inpatient needs. Please reach out to us if you have any questions about any of our services. I'm here at the Kentucky Regional Extension Center. We strive to serve as the trusted advisor to healthcare organizations, clinicians, and leaders across the Bluegrass. As you can see, we have partnered with organizations in almost every county in the state to improve the quality of care, reduce the cost of delivery, and improve the overall well-being of the Commonwealth. We have advisors who are located across the state and within your communities that understand the challenges that you may be facing. Let us be your resource as we work out together to build a healthier Kentucky. And we'll get started here today with promoting interoperability. So here we have an overview of the Promoting Interoperability, or PI category. In traditional MIPS, PI is weighted at 25% of your total MIPS score. If you have a special status designation of small practice, ambulatory surgical center-based, hospital-based, or non-patient facing, you do have an automatic PI reweight, which is going to move that weight to 0, and you would not need to submit for PI. If you do use this reweight, the weight for your other performance categories do shift some, and that quality category is going to bump up to 40%. So that's just important to keep in mind when considering using that automatic reweight. The automatic reweight also applies to eligible clinician type of clinical social workers. And then when you submit for PI, you have a couple of options available to you. You can sign in and attest. So with this option, you're manually attesting and entering your numerators and denominators for the objectives. You can also sign in and upload or direct submit via API. What option is best for you is really going to be dependent on your practice and your vendors. So PI is the foundational layer across traditional MIPS value pathways, and alternative payment models. So no matter how you participate in the quality payment program, PI is going to remain the same. How you submit for PI might look a little bit different depending on that level of participation, but your objectives and your measures are all going to remain the same. There are 5 objectives in the PI category. They include electronic prescribing, provider to patient exchange, health information exchange, public health measures, and attestation measures. The electronic prescribing objective has 2 measures, your e-prescribing and query of the PDMP. Your e-prescribing measure is going to evaluate how you use your EHR to review and send prescriptions. And this measure is going to be performance-based. You can receive between 1 and 10 points, and that's going to be based on your performance. And then query of the PDMP requires that you use CERT to query that PDMP, and then this measure is worth 10 points. Provider to patient exchange is going to evaluate providing patients access to their personal health information using a patient portal. This measure is also performance-based, and you can receive between 1 and 25 points based on your performance. The health information exchange objective provides you 3 options, and is worth a total of 30 points. Your first option is going to be to support electronic referral loops by sending and receiving health information. This option is performance-based, and you can receive up to 15 points for sending and then another 15 points for receiving, giving you the opportunity to reach those full 30 points. The other 2 options are to use a bidirectional exchange or to participate in TEFCA. If you use either of these 2 options, you receive the full 30 points for the objective. And then public health measures require that you have immunization registry reporting and electronic case reporting to receive the 25 points available for that objective. You can also earn an additional 5 bonus points if you have syndromic surveillance, public health registry reporting, or clinical data registry reporting. Having any one of these 3 will get you those 5 extra points. If you have more than one, you won't earn any additional bonus points beyond those 5 available bonus points. And then we have our attestation measures. This objective does not earn points for the category. It includes attestation measures that must be completed to participate in PI. So you need to attest to having completed your annual security risk analysis. You must also attest yes to completing the high priority practices safer guides, and then also attest to information blocking. Here we have the 2024 updates to the PI category. So one of the most important updates is moving to a 180-day performance period. Historically, PI has been a 90-day performance period, so this is a pretty substantial change to that reporting window. So this means that any agreements that you have with K-High for any of those public health measures we talked about, or bidirectional exchange, those are going to need to be in place before the beginning of your performance period. And then you're still able to choose which 180 days you want to report for PI, but that timeline is going to be a bit tighter for you. Another important change is the requirement to attest yes to the high priority practices safer guides. Previously, you could attest yes or no to this measure and receive credit. This is a must-pass measure, and starting in 2024, you must attest that yes to receive a score for the PI category. Attesting no or not attesting at all will make PI a score of 0. And just a reminder that your safer guides do sit outside of your SRA, and they're really that internal review, so they're completed within your practice. CMS also made a change to the PDMP exclusion. So starting in 2024, any MIPS eligible clinician who does not prescribe any Schedule II opioids or Schedule III or IV drugs can use this exclusion. In the past, there was a bit more flexibility. Going forward, it's only going to apply to those who do not prescribe those medications. They also removed all eligible clinician types, except for your clinical social workers, from the automatic reweight. They've been slowly removing these clinician types from that reweight over the years, and this year only those clinical social workers remain. This does not impact the reweight for small practices, though, or those with other special qualifying designations. And then CMS made a technical update to the e-prescribing measure, and they really just clarified verbiage to read that at least one permissible prescription written by a MIPS eligible clinician is transmitted electronically using CERT. And then they also clarified that the numerator statement would read number of prescriptions in the denominator generated and transmitted electronically using CERT. And CMS does provide some opportunities for PI hardships that sit outside of that automatic reweight available to those practices with special designations and clinical social workers. So they offer the opportunity to apply for a hardship if you have a qualifying reason. Those qualifying reasons include decertified EHR technology, insufficient internet connectivity, lack of control over available CERT, and an extreme and uncontrollable circumstance. Some examples of a qualifying extreme and uncontrollable circumstance include a disaster, a practice closure, financial distress, or certain vendor issues. It's important to keep in mind that the hardships are not automatically approved, and you must apply for them within the timeline provided by CMS. So during that timeline, you can apply on the QPP portal, and then when you apply, your request will be reviewed and you will be notified if it's approved or denied. And then if you participate in an APM, a hardship for PI cannot be submitted at that APM level, but your individual eligible clinicians or groups who participate in the APM can apply for that hardship at that individual or group level. If that hardship is approved, the eligible clinician or group would not need to submit for PI, but the APM would still need to submit. But thank you for your time, and we'll move into improvement activities for 2024.
Thank you for joining us today. So we're going to do a really high-level overview of improvement activities. improvement activities, the category assesses your participation in clinical activities that support improving clinical practice, your care delivery, and of course, patient outcomes. The improvement activities category is 15% of your total MIPS final score. There are over 100 improvement activities to choose from. So you have a large inventory to choose activities that best align with your practice. And these activities are divided into 8 subcategories, which you will see in the next slide. The performance period will be a minimum of 90 continuous days between January 2024 and December 31st of 2024. Important to remember, you should always retain documents for a minimum of 6 years, just in case of an audit. And in order to achieve credit for an activity, you need to select yes to implementing it. Therefore, this category is a yes or no submission, and you would keep that evidence in case of an audit. The maximum score of points you can receive for this category is 40 points. The inventory is divided in 2 types of improvement activities, high weighted and medium weighted. The high weighted is worth 20 points and your medium weighted activities is worth 10 points. So here's a list of your subcategories for the improvement activity inventory. So you have achieving health equity, beneficiary engagement, expanded practice access, care coordination, integrated behavioral and mental health, population management, emergency preparedness and response, and then you have patient safety practice assessment. And under each one of these subcategories, you will find a variety of activities. And these activities can be found on the QPP website. And it's an inventory that you can download into a zip file and actually review each one of the activities. So CMS always continues to update and modify this activity list. For 2024, there was 5 new improvement activities added to the inventory. There was a couple related to behavioral health and mental health. So this could really align with some practices who provide those services. There was 3 removed and there was 1 activity modified. And as I said, you can actually go into the inventory and actually look at review the 5 new ones and actually look at the one that's modified to give you a little bit more information about the activity. Okay, so if you are a small practice, if your special designation is a small practice and you reweight promoting interoperability, improvement activities becomes 30% instead of that initial 15% category weight. Clinicians must implement and attest approximately 2 to 4 improvement activities for that maximum score of 40 points. For most MIPS eligible clinicians, those groups and APM entities, each medium weighted activity is worth 10 points and each high weighted activity is worth 20 points. In the traditional MIPS track, if you have a special status designation, so for instance, if you are a small practice, if you are non-patient facing, if you're in a rural area or being in a health professional shortage area, these improvement activities are weighted higher. So the medium weighted activities will be worth 20 points and the high weighted activity is worth 40 points. MIPS eligible clinicians in a practice certified or recognized as a patient-centered medical home will receive 100% full credit for the improvement activities performance category. For organizations with multiple practices sites, at least 50% of these locations must be recognized or certified as a patient-centered medical home or comparable specialty practice to attest to this. Some of the commonly used improvement activities that we actually see our clients use are provide 24/7 access to MIPS eligible clinicians or group, which is a highly weighted activity. Regularly access patient experience of care and follow up on findings, which is highly weighted. Promoting clinician well-being, which is highly weighted. The engagement of patients through implementation of improvements in patient portal is medium weighted. Now, these are ones that are commonly used. These are not recommended or suggested for your practice, but these are commonly used among our practices that we work with. So the best suggestion or recommendation would be you to review the inventory, look at each one of the activities, and best choose the one that's best aligns with your practice. So thank you today for joining us to discuss promoting interoperability and improvement activities. We want to invite you to our annual conference on October the 24th at the Campbell House in Lexington, Kentucky. Registration is now open. You can scan the QR code on the slide, or you can visit our event website to register. We would love to see you there. And as always, we are on Facebook and we are on X and LinkedIn, and or you can visit us on our website, KentuckyREC.com, or email us at KentuckyREC@uky.edu, and someone will get back with you with any questions that you may have. And always reach out to your advisor for any questions or any resources that you would need. And again, thank you so much for joining us today.